So welcome back to yet another episode of Paramedic Zach. In this episode, we'll be reviewing flashcards 111 through 120. Let's go. Alrighty, so welcome back, or welcome for the first time. If you didn't know, my name is Zach and I review flashcards to help you get ready for your paramedic exam or other applicable test. And with that, we're going to start off with question 111. What is your cardiac arrest epinephrine dose if given via an endotracheal tube? So you can remember the medications that you can give as a paramedic through an endotracheal tube with the acronym LEAN. Lidocaine, epinephrine, atropine, and Narcan. The dose for an endotracheal tube medication needs to be 2 to 2.5 times higher than that you'd give via an IV or an IO. Therefore, the 1 milligram dose of epinephrine that you'd normally give in a cardiac arrest via an IV or an IO is going to be 2 to 2.5 milligrams, and this needs to be a 1 in 1,000 concentration that is mixed in 10 mLs of normal saline. Moving on to question 112. What is your synchronized cardioversion dose in joules for a narrow irregular rhythm, i.e. AFib? So the dose in joules that you're going to be using to cardiovert your patients in AFib with RVR is going to be 120 to 200 joules. Moving on to question 113. Use albuterol with caution in patients presenting with wheezing and symptoms consistent with congestive heart failure. Albuterol can cause blank. So you want to be wary of giving your congestive heart failure patients albuterol because it can cause flash pulmonary edema. Moving on to question 114. Where on your end-tidal CO2 waveform is the end-tidal CO2 measured? So your end-tidal CO2 is going to be measured at the highest point on your waveform, which is going to represent the end of the patient's exhalation. Moving on to question 115. Name 2 ECG diagnostics for hypokalemia. Hint: extra wave. So as opposed to hyperkalemia, where you see tall peak T waves, with hypokalemia, you're going to see flattened T waves and possibly a U wave after the T wave. Question 116. How do you preserve an amputation? Alrighty, so the steps in preserving an amputation are going to be 1. Rinse it with saline. 2. Wrap it in saline-soaked gauze. 3. Seal it in a plastic bag. And 4. Place it in a cooler, ensuring that it does not freeze. However, you don't want to spend any extra time on scene looking for the amputation. You should transport the patient immediately, regardless if the amputation can be found. Question 117. Pericarditis will usually present with PR segment blank in most leads. So on your ECG, pericarditis will usually present with PR segment depression in most of your leads. You can also ask your patient if the pain gets worse when they're lying supine. If it does, this may be an indication of pericarditis. Question 118. Since blood going to the fetus is already oxygenated by the mother, blood in the fetus can pass from the right atria to the left atria via the blank. So the ability for the fetus to shunt blood from the right atria to the left atria is due to the presence of the foramen ovale. Moving on to question 119. To calculate heart rate, the box or sequence method uses the estimates of blank, 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 blank for each sequential big box. So in order to calculate heart rate using the box method, you're going to use the estimates of 300, 150, 100, 75, 60, and 50 for each sequential big box. And of course, this method can only be employed with regular rhythms. And lastly, we have question 120. A reversible autoimmune condition that attacks the myelin sheath, causing rapid onset of weakness, paresthesia, and possibly paralysis starting at the legs and moving up the body, is known as blank. So this autoimmune condition, and I may be butchering the name again, is known as Guillain-Barré syndrome. Thanks again for joining. I just wanted to remind everybody that in the description are timestamps with all of the questions. So if you're looking for something specific, make sure you check that out. If you got anything good out of this video, please do me a favor and hit the like button. And if you want to get these videos regularly to help you pass your exam, make sure you subscribe. Until next time, take care.